While the notion of cancer can bring on feelings of isolation and fear, you can take heart in knowing that you're not alone. You'll be supported by a team of healthcare professionals who work in different capacities to identify and recommend the proper treatment for your disease.
The two main types of doctors involved in the diagnosis and treatment of cancer are oncologists and pathologists. Pathologists work behind the scenes in laboratories to identify your cancer using blood or tissue samples, while oncologists use this information in working with you to plan treatment. The path to treatment begins when you show symptoms of having cancer and go to an oncologist to receive blood tests, x-rays, or other diagnostic tests. While initial testing can shed some light on what is wrong, the actual diagnosis of most cancers requires a biopsy, a procedure that removes the tumor tissue sample for analysis. In certain instances, cancers of the blood can be identified through the testing of the blood alone, but in other instances, a biopsy is needed to confirm a diagnosis. It's important to ask your oncologist about what type of biopsy you will receive, how your sample will be saved, and what specific type of testing will be performed to identify the unique characteristics of your cancer. Biopsy samples are sent to pathologists who analyze the tissue and fluid to provide doctors with information that they use to diagnose and stage cancer. Pathologists use microscopes to help identify cancer, but they also have access to advanced molecular diagnostics that may offer them more specific information about what may be driving cancer in your cells.
As a pathologist, I want the most detailed information I can get. While identifying the presence of cancer is one step, it is also extremely valuable to do molecular level testing. This type of testing can help predict the aggressiveness of a particular patient's cancer and help your oncologist identify the types of treatments that may best stop its progress.
After pathologists evaluate the cancer in a biopsy sample, they produce a report that provides your oncologist with information about it, including the extent of the cancer and how quickly it is likely to spread. This report contains some of the information your oncologist uses to formulate a treatment plan.
I want access to as much information as I can get before I discuss treatment options with my patients. The more detailed information I have, the easier it is to decide on which therapies and drugs may work best for a particular patient. However, the rapid advancement of cancer research and treatments means there are many drugs and diagnostic tools available to assist in developing individualized treatment plans. Patients can help by asking their oncologist about options like molecular level testing before a treatment decision is made. Molecular level testing in some instances can provide valuable patient-specific information that may help guide difficult treatment decisions. Knowing more about your cancer can be the key in finding therapies or medicines that may be best suited to fight your cancer.
Asking your oncologist about how your cancer is different is an important step you can take to advocate for yourself.